What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my embryology playlist. In previous videos, we talked about fertilization, the zygote, the morula, the blastocyst and its cavity, the blastocele, implantation, gastrulation, and the bilaminar embryo, which means 2 layers. After that, we go to the tri-laminar embryo, which is made of 3 layers. On the inside, we have endoderm. Endo means inside. On the outside, we have an ectoderm. Ecto means outer or external. And in the middle, we have the mesoderm. The word meso means in the middle. What are the derivatives of the endoderm? What are the derivatives of the mesoderm? And what are the structures that are derived from the ectoderm? Let's find out. Click the like button, click the subscribe button, and let's start at the beginning. No pun intended. You can find this video in my anatomy playlist or in my embryology playlist. By the way, my anatomy playlist has review videos for every branch in anatomy, including neuroanatomy. Let's start embryology with the basic non-negotiables. Mistakes in the basics are not allowed. The following facts are so basic that the pH is starting to rise. Non-negotiable fact is to know the difference between the bilaminar embryo and the trilaminar embryo. The bilaminar embryonic disc happens within the 2nd week. How about the trilaminar? It happens in the 3rd week of embryological development. What are the 2 layers of the bilaminar embryonic disc? One of them is called the epiblast, and the other one is called the hypoblast. So epiblast and hypoblast are the 2 layers of the bilaminar embryo. Epiblast is ectodermal. Hypoblast is endodermal. Where is the mesoderm then? The mesoderm has not appeared yet. When the mesoderm starts to appear, now it's trilaminar. Now the embryo has an ectoderm. Now the embryo has an endoderm, but that's not new. We know that from before, because the epiblast is ectoderm and the hypoblast is endoderm. The 3rd layer, the brand new layer, is the mesoderm. And here I'm talking about the mesoderm that's inside the embryo, or the intra-embryonic mesoderm. What does the word meso mean? Meso means in the middle, as in mesencephalon. Do you remember your midbrain? Midbrain is mesencephalon because in the middle. It's between the forebrain and the hindbrain. Similarly, mesoderm is called meso because it's in the middle. It's between the endoderm and the ectoderm. The word endo means on the inside. This is going to give you your guts. And the word ecto means on the outside. This is going to give you the epidermis of your skin. There are 2 types of mesoderm. There's mesoderm that's part of the embryo, called intraembryonic mesoderm, and mesoderm that's not part of the embryo itself. So we call that extraembryonic mesoderm. Which one of the 2 develops earlier? The extraembryonic mesoderm shows up before the intraembryonic mesoderm. The extraembryonic mesoderm will be divided into 2 types, whereas the intraembryonic mesoderm will be divided into 3 categories. The 2 categories of the extraembryonic mesoderm are the somatic layer and splanchnic layer. Somatic is parietal, splanchnic is visceral. So we can call the somatic layer somatopleuric and the visceral layer splanchnopluric. If you've watched my neuroanatomy playlist, you will remember that the word visceral is synonymous with splanchnic, which is synonymous with autonomic. The extraembryonic mesoderm's parietal layer is in contact with the ectoderm, but the visceral layer that's near your guts, it's more visceral. So it's in contact with the endoderm. In the meantime, intraembryonic mesoderm is divided into 3 types. Paraaxial mesoderm, intermediate mesoderm, and lateral plate mesoderm. The lateral plate is lateral, the paraaxial is medial, and the intermediate, well, is in between. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, please reach out to me on my website. Have you ever wondered where we got these symbols from? Next, please do not confuse the gonads with the gametes. The gonads are ovaries in females, testicles in males, but the gametes are the cells produced by the gonads. The ovaries will make ova, and the testes will make sperms. Ova and sperms are gametes, but ovaries and testicles are gonads. How do we make ova? How do we make sperms? Through meiosis and not mitosis. The legend has it that this female symbol resembles a mirror. My poor patient has lupus. It's a malar rash, butterfly rash, which involves the nose and the cheeks, but spares the nasolabial folds. As for the male symbol, according to legend, this is where it came from. Next, another common mistake that students make is that they say, oh, the sperm meets the ovum. That's a bunch of nonsense. That's a load of bilgewater. What actually happens is that the sperm meets the secondary oocyte. The sperm never met an ovum, ever. The sperm meets the secondary oocyte that has been arrested and did not complete its meiotic division or meiosis. So it's not an ovum yet. But once the sperm goes deep inside the secondary oocyte, it will complete its meiotic division and change from a secondary oocyte to an ovum. But this only happens after the sperm goes in. Through parentage, we bridge the chasm of the generations and elude the enmity of death. Here, even in the flood, children are born. In the chaos of a car crowded with refugees, twins suddenly appear. There, solitary in a tree and surrounded by raging waters, a mother nurses her babe. In the midst of death, life renews itself immortally. By the way, I have a playlist titled In 90 Minutes Quick Review, where you find review videos for every branch in anatomy, including neuroanatomy and embryology. Each branch is covered in 3 videos. For example, anatomy of the thorax has part 1, quick review, part 2, ultimate review, and part 3 is clinically oriented anatomy of the thorax, and we repeat the same process for every subject in anatomy. I also have physiology review videos, biochemistry review videos, molecular biology review videos, genetics, pharmacology, and pathology review. And I cannot forget about microbiology. There is a video reviewing general microbiology, another for gram-positives, another for gram-negative bacteria, another for viruses, another for fungi, and another for human parasitology. And if you want the systems, I have internal medicine review videos. I review cardiology in 2 videos. One is for basic cardiology and one is for clinical cardiology. The first has the anatomy, the physiology. The second has the pathology, pharmacology, and internal medicine. Neurology, 2 videos. Pulmonology, 2 review videos. Endocrinology, 2 videos. Hematology, 2. Oncology, immunology, rheumatology, nephrology, GI, and dermatology. I did not forget about ophthalmology and ENT. Review videos for infectious diseases, geriatrics, EKG, emergency medicine, and if you want me to make review videos on the following subjects, please let me know in the comments. I also have review videos for these surgery topics. All of these review videos are to be found in my playlist titled In 90 Minutes Quick Review. These videos are excellent before your exams because unfortunately many students wake up 2 days before the exam. That's why I created such a playlist. With regards to video number 1 of Embryology Review, also known as Quick Review, it will teach you about all of these topics, including meiosis and mitosis, male versus female anatomy, spermatogenesis versus oogenesis, fertilization, implantation, gastrulation, the 2-layer embryo, the 3-layer embryo, the foldings, the neurulation, the decidua, and the 3 types of decidua, the fetal membranes, which are 5, the placenta, the amnion, the chorion, the umbilical cord, the yolk sac, the allantois, and twin pregnancy or multiple gestations. In video number 2 of Embryology Ultimate Review, you will learn about systemic embryology, how the skeletal system develops, bone and muscle, how the cardiovascular system develops, heart and vessels, the fetal circulation, how the brain develops, the development of the eye, of the respiratory system, GI system, urogenital, and endocrine glands. Back to the video. Fertilization is when the sperm meets the secondary oocyte. The ovum is always X. The sperm could be X or could be Y. If an X sperm meets an X ovum, or I should say secondary oocyte, you get XX, which is a female. But if Y meets X, you get XY, that's a male. When the sperm meets the secondary oocyte, fertilization happens, the ovum matures, and now we have a zygote. The male gamete or sperm has 23 chromosomes. The female gamete has 23 chromosomes. Combine them together, you get one zygote, which is 2 plus 2 is 4, 3 plus 3 is 6. 46 chromosome is the zygote. Then, by a series of mitotic divisions, not meiotic anymore, but mitotic, this is mitosis, the zygote will grow into an embryo. and the embryo will become a fetus. And once the fetus is born, it's called a neonate, and then an infant. So from fertilization to 8 weeks, during gestation, during pregnancy, that's an embryo. From 8 weeks until birth, it's called a fetus. Once it's born, it's an infant. Profound too is the myth of Isis, the Great Mother. She was not only the loyal sister and wife of Osiris. In a sense, she was greater than he, for like women in general, she had conquered death through love. Nor was she merely the black soil of the delta, fertilized by the touch of Osiris Nile, and making all Egypt rich with her fecundity. If you want to learn more about fecundity versus fertility, please refer to my obstetrics and gynecology playlist. And then XX, that's a female, XY, that's a male. 23 chromosomes here, 23 chromosomes there, 46 chromosome here. You have 44 somatic chromosome and 2 sex chromosomes. 44 somatic plus 2 sex equals 46 total chromosomes in every cell of your body except ova or sperms. When the sperm meets the secondary oocyte, sperm goes up, meets the secondary oocyte in the ampulla of the fallopian tube. Together they will form a zygote. The sperm is going to meet the secondary oocyte, and the steps of fertilization are 5. Capacitation, acrosome reaction, polyspermy block, completion of meiosis II, where the secondary oocyte becomes a mature ovum, and to make a zygote. Step number 1, capacitation. What does that mean? Acquiring a capacity to fertilize. Remember that the sperm matures partly in the epididymis and partly by secretions from the female genital tract, such as the uterus. This destabilizes the plasma membrane of the sperm, making the tip of the sperm sharp and ready to go deep inside. This is called the acrosome reaction. Moreover, calcium permeability increases. Calcium is the hero of contraction, which increases the strength and the speed of the beating of the flagellum of the sperm until the sperm reaches its full capacity. #capacitation. Next is the acrosome reaction. In order for fertilization to take place, the sperm and the oocyte need to recognize one another. Why? To ensure same species fertilization, so that you do not end up with a child that is half human and half goat. Unless your child is Lionel Messi, in which case the acrosomal reaction has left the chat. How does the acrosome reaction take place? When the sperm reaches the zona pellucida, which is this indigo or light blue color, it's called zona pellucida because it's very clear. When the sperm reaches the zona pellucida, actin filaments will bind something called ZP3, which is a protein in the zona pellucida. Z for zona, P for pellucida. This will release hydrolytic enzyme from the sperm's acrosome. Acro means extremity or the tip. And this will digest the zona pellucida so that the sperm can go deep inside. Step number 3 in fertilization is polyspermy block. Here's the thing. Do you want your offspring to be like you, diploid, or do you want your offspring to be different? Of course, we want to be normal human, 2N, diploid, 46 chromosomes. And therefore, once the first sperm has entered, we should block any other sperm from entering. And this is called polyspermy block. Block the entry of many sperms. There is a fast block and there is a slow block. Fast block happens by depolarization, thank you sodium. Slow block happens via calcium. Calcium is always slower than sodium because calcium channels are slower than sodium channels. Just like calcium is the hero of contraction, it's also the hero of cortical reaction, which causes exocytosis of cortical granules, which were here in the secondary oocyte, and they will make the zona pellucida impenetrable to any other sperm. Moreover, the exocytosis will cut the link between the cell membrane and the zona pellucida, making it virtually impossible for another sperm to enter. You only need one sperm and one secondary oocyte. That's it. Extra sperms are not welcome. #polyspermy block. And this takes the phrase, quote, she blocked me, unquote, to a whole other level. Step number 4 is the maturation of the secondary oocyte into a mature ovum and release of the arrest of metaphase 2, we're gonna finish meiosis 2 and become a mature ovum. This only happens after fertilization. Step number 5 is zygote formation. One sperm and one secondary oocyte, we can call it ovum now, will equal one zygote. The zygote is diploid with 46 chromosomes. And then, by a series of mitotic divisions known as cleavage, because one cell will be cleaved into 2, and then to 4, to 8, to 16, etc., you will have an embryo. Here is one cell, which is the zygote. You can call this day 0 or day 1, no one cares. Then cleavage by mitotic division from one cell into 2 cells, and then 4 cells, then 8 cells, then 16 cells. When it's about 12 to 16 cells, we call it the morula. The morula does not have any cavity on the inside, and this occurs about day 3 or day 4. After the morula, you have the blastocyst. And unlike the morula, the blastocyst actually has a cavity inside. It's called the blastocyst cavity or blastocele. Again, cele means cavity. This is the blastocyst that will be implanted into the uterus. More superior than inferior, closer to the fundus than to the cervix, and more posterior than anterior. After this, we should have the bilaminar embryo in the second week. Bilaminar because we have 2 layers, epiblast, which is ectoderm, and hypoblast, which is endoderm. Followed by the trilaminar embryo in the 3rd week. And what are the 3 layers? Endoderm, mesoderm, and ectoderm. Epiblast, that's the ectoderm. Hypoblast, that's the endoderm. And the mesoderm is new. Don't forget, we have an extra-embryonic mesoderm and intra-embryonic mesoderm. Here, I'm referring to the intra-embryonic mesoderm. The inner cell mass is the embryoblast. It will become the embryo itself. Whereas the outer cell mass is the trophoblast, which will become the chorion, which will become the placenta. The blastocyst cavity, also known as the blastocele, will turn into the cavity of the yolk sac. This is the blastocyst. This is the cavity of the blastocyst. We call it blastocyst cavity or blastocele. This is the amnion, which contains amniotic fluid. And this is the chorion, which will become the placenta. And the placenta will attach the baby to the mother. And there will be a lovely connection between them called the umbilical cord. This membrane is called the amnion. This is the amniotic fluid in the amniotic cavity. This is the yolk sac cavity. As for this cavity, it's something called extra-embryonic coelom. But I digress. What got implanted again? What got implanted is the blastocyst. After implantation, we're gonna welcome the bilaminar embryo in the 2nd week. In the 2nd week, we use the mnemonic of 2. Everything here is 2. The embryo is made of 2 layers, bilaminar. What are the 2 layers? We have an ectodermal layer known as epiblast and an endodermal layer known as hypoblast. But I digress. Back to the blastocyst. We have an inner cell mass and outer cell mass. These are 2 in the 2nd week. Then we have 2 different things, the trophoblast on the outside and the embryoblast on the inside. Each one of them is subdivided into 2. There are 2 types or 2 parts of trophoblast. Cytotrophoblast and syncytial trophoblast. And there are 2 layers in the embryoblast. We have ectodermal layer known as epiblast and endodermal layer known as hypoblast. And that's why we say bilaminar embryo or bilaminar germinal disc or embryonic disc. And if that was not enough, we have 2 cavities. The amniotic cavity, which contains amniotic fluid, and the yolk sac cavity, which does not contain any yolk. What's the difference between cytotrophoblast and syncytial trophoblast? Well, cytotrophoblast is more inwards, but syncytial is more outwards. But what does the word syncytial mean? The word syncytial means syncytium. What is a syncytium? A group of different individual cells forming a singular unit, such as a bunch of people working in one team, and they merge together seamlessly. Which means that these cells do not have clear boundaries between the cells. It's as if they share their cytoplasms together, forming one unit, forming one syncytium. Hashtag syncytial trophoblast. Does anyone remember your cardiac muscles? The cardiac muscles, thanks to gap junctions, contract together as a singular unit, as a syncytium. And that's how both of your ventricles, which are huge, contract together. Why? Gap junction. Syncytium, baby. Again, remember that at the 2nd week, everything is 2. You have outer cell mass and inner cell mass. The trophoblast is divided into cyto and syncytial. The embryoblast is divided into epiblast and hypoblast. And you have 2 cavities. amniotic cavity and yolk sac cavity. This is the amniotic cavity. This is the yolk sac. This is amnion. This is ectoderm. This is endoderm. Between the ectoderm and the endoderm, the third layer will appear. And that's how you take the bilaminar disc of the embryo and convert it to trilaminar, from only 2 layers into 3 layers. The third layer is the mesoderm, which grows out of the ectoderm, so to speak, and then finds its way between the 2 layers, because the word meso means in the middle. Meso means mid, just like your jokes. This is the connecting stalk, which is extraembryonic mesoderm, which will connect you to the chorion and placenta. Later, you will see the umbilical cord growing near this area. Bulging out of the yolk sacs, endoderm, is the allantois, which will connect the apex of your urinary bladder to the umbilicus. To learn about the changes that happen during pregnancy, to learn about pregnancy complications and the complications of birth, and to learn about breast cancer, ovarian cancer, endometrial cancer, cervical cancer, vaginal cancer, and vulvar cancer, download my obstetrics and gynecology high yields course, which you can download today on my website, medicosisperfectionalis.com. It comes with videos, notes, and cases. Now let's review the most important points in today's video. We have bilaminar embryo of endoderm and ectoderm, hypoblast and epiblast, and that's it. Then the bilaminar will become trilaminar embryo with endoderm, ectoderm, and mesoderm in between. This is endoderm, ectoderm, and mesoderm in between. The intraembryonic mesoderm grew out of the primitive streaks growth and proliferation and migration. What will the endoderm give me? The endoderm derivatives include the epithelium of the digestive system and the respiratory system, most of the bladder except the trigone, and the urethra. Then a bunch of glands like the pancreas, the liver, the gallbladder, the tonsils, thymus, thyroid, and parathyroid, even the middle ear and the eustachian tube, which connects the middle ear to the nasopharynx. All of these are endodermal derivatives. Next, we'll talk about the mesoderm. Every connective tissue type that you can imagine is mesodermal in origin. I am talking bones and cartilages, muscles and tendons, blood and lymph, even the blood vessels and lymph vessels. The cardiovascular system, such as the heart and the vessels, are mesodermal in origin. The kidneys and the ureters are mesodermal in origin. The trigone of the bladder is the only part of the bladder that is mesodermal in origin, but the rest of the bladder is endodermal. The mesoderm will give me the dermis of the skin, but the epidermis of the skin came from the surface ectoderm, which is ectodermal in origin. So the dermis is mesodermal, but the epidermis is ectodermal. The adrenal cortex is mesodermal, but the adrenal medulla is a ganglion. Where do ganglia come from? Oh, ganglia are part of the peripheral nervous system, so they come from neural crest cells, which are ectodermal. So the adrenal cortex is mesodermal, but the adrenal medulla is ectodermal. The dura mater is mesodermal, but the pia and the arachnoid maters are ectodermal. The microglial cells are mesodermal, but the rest of the glial cells are usually ectodermal. So the microglia, which are part of the neuroglial cells, are mesodermal. However, the astrocytes, the ependymal cells, the oligodendrocytes, and the Schwann cells are all ectodermal in origin. The spleen is a blood organ, basically. That's why it has a red pulp, because it appears red because of all of that blood. So the spleen is mesodermal in origin. But how about the white pulp of the spleen? The white pulp of the spleen is white because it's immunological, because the spleen is a lymph organ, so to speak. Also mesodermal. And your 3 serosal membranes, pleura, pericardium, and peritoneum, are mesodermal in origin. Next, the ectoderm will give me 2 things: surface ectoderm for the surface and neuroectoderm for the nervous system, central and peripheral nervous system. Tell me more about the surface ectoderm. It will give me the epidermis of the skin, but not the dermis, because the dermis is mesodermal. And what's in the skin? Hair and nail, sweat glands. Don't forget that your sweat is smelly, so I'm also going to give you olfactory epithelium of the nose. Don't forget that the sweat of your axilla is going to stain your shirt. So I'm going to put the lens in your eye to see the stain and wash your shirt, you freaking filthy person. Now at this moment you are opening your mouth and saying, how dare you medicosis say such a thing? The epithelium of your mouth and your anal cavity is derived from the surface ectoderm. It's gum and bum. So, you want a cool story to remember the derivatives of the surface ectoderm? There you go. Imagine that you went shopping. You were trying to find a hair and nail salon. Next to that, there was a dermatologist office because of the epidermis. So dermatologist and hair and nail salon. Then you went sweating into the gym next door. Next to that gym, there was an optometrist, the lens of the eye. Beside that, there was a flower shop where you stimulated your olfactory epithelium of your nose. And then, because you were not raised right, you started to cuss at people and shout profanities with your mouth. So the police officer took you and put you in jail, where some really horrible and ugly things happened to you that I cannot utter because I was raised better. And that's how we remember all the derivatives of the surface ectoderm, such as the epidermis of the skin, hair and nail of the skin, sweat glands of the skin, the lens of the eye, olfactory epithelium of the nose, epithelium of the gum and bum, mouth and anal cavity. That is the surface ectoderm, but the other ectoderm is neuroectoderm. That's for your nervous system. You have neural tube for the central nervous system and neural crest for the peripheral nervous system. What are the cells that myelinate the central nervous system? Oligodendrocytes. So they come from neural tube. How about the cells that myelinate the peripheral nervous system? These are Schwann cells, also derived from neural crest cells. Glial cells are derived from the neuroectoderm, except microglia, because the micro with the M is mesodermal with the M. Ependymal cells that secrete cerebrospinal fluid came from neuroectoderm. And then I've told you before that neural crest cells love to migrate. They migrate everywhere. They migrate to the adrenal medulla, because the medulla of your adrenal gland is a specialized ganglion. And what's the definition of ganglion? A ganglion is a collection of somas in the peripheral nervous system, and that's why they come from the neural crest. So all of your ganglia, including the adrenal medulla, which is a specialized ganglion, came from the neural crest. The pia mater and the arachnoid mater came from the neural crest of the ectoderm. However, the dura mater came from the mesoderm. Enterochromaffin cells, or APUD cells, such as the ones that secrete serotonin and the ones that are scattered across your gut, are also ectodermal in origin. The neural crest will also migrate and give you the melanocytes, which secrete melanin in your skin, and will migrate to your teeth to give you odontoblasts, #dentin, #dentist, and will migrate to the heart to give you the membrane that spirals, the spiral membrane. It spirals out of control until it gives you the aorta and the pulmonary trunk, or the pulmonary artery. And the neural crest cells will migrate to the heart to give you the endocardial cushion, which are part of the endocardium, but the rest of the heart is mesodermal in origin. The neural crest also contributes to skull bones. And that's it. Please take a moment to pause and review the derivatives of the endoderm, the mesoderm, and the ectoderm. This is one of the most important topics in embryology. Professors love to ask about these, so make sure to review. Now let me review the difficult parts of the trilaminar embryological developments. The first difficult subject is the adrenal gland, which has a cortex on the outside and a medulla in the core, in the center. The cortex is derived from the mesoderm, whereas the medulla is ectodermal in origin. Which ectoderm? Is it surface ectoderm? No. Is it neuroectoderm? Yes. What kind of neuroectoderm? Is it neural tube? No. Is it neural crest? Yes, because the adrenal medulla is a ganglion. Treat her like a ganglion, and all the ganglia are neural crest in origin. The second confusing subject is the urinary system. Look, the kidney and the ureter are mesodermal in origin. The trigone of the bladder belongs to the ureter, so it's also mesodermal. The rest of the urinary bladder and the urethra are endodermal in origin. Listen to me carefully. The most distal part of the urinary system is endodermal. And the most distal part of the vaginal canal is also endodermal, just like the urethra. Whereas the upper or the proximal part of the vaginal canal is mesodermal, just like the kidneys and the ureters. Now let's talk about another canal, the anal canal. Above the pectinate line, endodermal. Why? Because it's part of the gut. It's part of the GI. It's part of the gastrointestinal system, which is endodermal. But the anal canal distal to the pectinate line, or the lineum pectinatum, is ectodermal in origin because it's part of the skin, and the skin is ectodermal, at least the epidermis is. Another very confusing topic is the origin of the thyroid gland. If you have watched my videos on the thyroid gland and the thyroid hormone, see my physiology playlist, I've told you that the thyroid gland is made of a bunch of follicles. And then we have cells inside the follicle and cells outside the follicle. The cells inside the follicle are known as follicular cells. The cells outside the follicle or between the follicles are the parafollicular cells. Follicular cells are known as A cells or thyrocytes, whereas the parafollicular cells are known as C cells for clear. Follicular cells are endodermal in origin, which is not shocking because we said that the thyroid is endodermal. But what about the parafollicular cells? Before recording this video, I checked ChatGPT AI, and AI told me that the parafollicular cells are ectodermal, specifically of neural crest origin. But this is old and outdated. The parafollicular cells are also endodermal in origin. That's the truth. Artificial intelligence, they said, more like natural stupidity. The parafollicular cells of the thyroid are associated with the ultimopharyngeal or ultimobranchial body, which is a ventral derivative of the fourth or the fifth, depending on how you count, pharyngeal pouch, and all of the pharyngeal pouches are endodermal in origin. So the entire thyroid gland is endodermal in origin. Whether you're talking about follicular cells or parafollicular cells, I don't care. The entire thyroid is endodermal. And that's why instead of relying on AI blindly like a doofus, maybe, just maybe, every once in a while you should, I don't know, read a textbook. Boomer talking, we get it. And that's why society is degenerating. Enjoy the decline. But before this happens, make sure to watch my video on the pharyngeal arches and my video on the aortic arches. To learn about estrogen, progesterone, prolactin, thyroxine, cortisol, insulin, and more, download my endocrine pharmacology course at medicosisperfectionalis.com. After mastering embryology and anatomy, it's time to learn about surgery. I have a surgery high yields course on my website medicosisperfectionalis.com. I help you learn, understand, and pass exams. Don't forget to check my embryology quick review video for general embryology and my embryology ultimate review video for special embryology or systemic embryology. You will learn about these topics in the first review video of embryology, and you will learn about these topics in the second embryology review video. All of these videos are to be found in this playlist. I'll leave the link in the comments. There are more than 750 premium videos available on this channel. When you click the join button and choose the highest tier, please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.